to Biotech Talk, your one-stop show for all the tidbits from the life sciences and biomedical industry. So today we have a really, really interesting man in with us. I cannot stop smiling whenever I see this guy. He himself is always smiling. He is the man behind Leader Life Sciences, Leader Biotech Pharma, the managing director of both this amazing entity, Mr. Nirmal Kumar.
Thank you, Mala. Thanks for the interesting introduction.
Interesting introduction. I know.
First of all, it's a pleasure to be part of this podcast, and thanks for inviting me.
Yes. I mean, we have been talking about it for so long. Are you excited to be here finally? Like it's actually materializing and we are really doing it. It's
Absolutely. It's something like our curiosity never ends. with
yeah,
anything.
exactly.
So something exciting, something new, something innovative
Yeah,
is the way to go, right?
absolutely. That's the only way to break the clutter. And something to say about Nirmal is that, he has been in the industry and he transitions from each personas over his career. He starts as a scientist. First he was an engineer, then he was a scientist. Now he's a businessman. It's like, I don't know how you do it. How do you do it?
I mean, as I just said a few seconds back, and you should be curious and you should be, excited for what next.
Hmm.
And in that context, when you really want to do something, I always believed in manifesting, and then the universe shows you the path,
Yes.
right? So, a very passionate scientist into multiple facets of R&Ds and productions and stuff. So, potentially, when you are into the zone, into the core, you get to see a lot of opportunities and a lot of gaps, which turned out to be business opportunities for me, of late. So that's the simple journey of a scientist to an entrepreneur right now.
He's truly every conversations with him makes me think about certain things, and that's why he's actually my mentor too. So anyways, I think we will get into the topic. So we have 10 minutes and 10 minutes to discuss a very long topic that you
Just
really
10
love.
minutes?
Yes, exactly.
Wow.
I know that you like to talk a lot, but unfortunately, we need to curb this thing. We want to give the audience very precise this thing.
Sure.
So today's topic will be from vision to reality, the transformative power of life sciences. So I think it could be a story of you at this point because the journey is quite exciting for another podcast. Okay, so let's start with the first question, which is we have in this biotech talks. This is the 9th episode. We have gone through various topics, more like a workflow sort of thing. We started with biobanking, then we went into histopathology, the diagnostics, in vitro, in vivo research, and everything. So, what do you feel is the how do these things, these topics, especially affect life sciences or biomedical innovations as a whole?
In fact, and again, I have to go back a little bit, more of a retrospection is needed right now.
Yes.
So I was wearing a white coat, but slightly different one, a lab coat.
Okay.
So sitting inside the biosafety cabinet and then thinking how to extract a DNA.
Yes.
So potentially during my days, like not the dinosaur period, but just 10 years back, 10, 12 years back into the laboratory, where you get to prepare those reagents, buffers, and all possible aspects yourself.
Okay.
So potentially there's nothing called sophisticated kits and stuff. And then finally you have to work on your sample. It could be a blood sample or plasma or whatever it is, and then extract the DNA of your interest. So then after extracting that, you could see a thread, and then in that thread should be intact.
Oh wow.
Stability of the DNA matters, and you have to quantify it. So bottom line, from there to what's happening right now, is something phenomenal. The
Mm-hmm.
technology transformation happened so much.
Mm-hmm.
Right now, we just have to go and then put the sample
Mm-hmm.
in a particular slot.
Mm-hmm.
You get to receive whatever yield of DNA that you're looking for.
Wow.
So it's pretty much automated, pretty much sophisticated. So
Mm.
in this context, every workflow that when 10 years back, that like I was looking, okay, why can't we automate this?
Mm.
Why can't
Mm.
we have a nice sophisticated technology to address this?
Mm.
Because I definitely, all the researchers out there watching,
Mm.
and the diagnostics experts, and they will definitely could relate to it, because their ultimate objective is the end result,
End result, yes.
and then starts the interpretation and then deriving a whole
Yeah, yeah.
outcome. In this context, and if someone is worried about a basic step
Mm.
or a basic workflow,
Mm-hmm. Mm-hmm.
it makes all the more difficult for that person to
Yes.
see the results end of the day, right? So
Mm.
my idea here always been is that to make the scientific community's life easy
Mm-hmm.
by automating, by bringing in all the smart tools and technology, and make the workflow look very, very simple,
Mm-hmm.
so that all that they have to worry about is the end objective.
Okay.
So in this context, lots of technologies had to be introduced,
Mm.
and so we keep hunting.
Mm.
Hunting is the right word, because we keep looking for innovative products that can really transform a particular workflow or a particular technology, the ecosystem.
Mm.
That's something that is our ultimate mission.
Mm-hmm.
And bringing in those innovations into different facets, be it the biobanking, we brought in the automated biobank solutions.
Mm-hmm.
In pathology, it's always conventional, classical,
Mm.
but we brought in the digital mode of pathology,
Mm-hmm.
more of a digital pathology they call it,
Mm.
and also introduced a 3D cell culture, 3D bioprinting from
Yes.
a 2D to 3D. So a lot of interesting things being introduced, just having it in mind
Mm.
to make a scientist/researcher's life easy.
Easier.
Yeah.
That's very well put.
Yeah.
As usual, the more quite poetic man that he is. Tell me, AI is the hot topic in the all industry. In fact, every one of the conversation I've had on this show till now, we have brushed up on this topic. So I have to ask, how important would AI be in this scenario?
Yeah. AI is confusing. AI is interesting, exciting,
Mhm.
and right now AI is overwhelming
Mm.
on an outlook.
Mm.
But the ultimate aim of AI or ML is to make all those complicated stuff break into small pieces,
Mhm.
and then give you a rational to it.
Mhm.
Just going back to just like few years back, and then we always worried about having a hardware,
Okay.
just taking a DNA sequencing for that matter.
Mhm.
Those days, the first human genome, was sequenced for more than 14 years,
Mhm.
and thousands of people involved in that.
Mm.
Billions of dollars been put in.
Mm.
And then we sequenced one sample, one human genome
Mm.
entirely.
Mm.
And, it's just like the celebration of humankind.
Yes.
Phenomenal effort, isn't
Yes.
it? But right now, the same sequencing could be established with one person, maybe a couple of members,
Mm.
and within $100,
Mm-hmm.
in a span of 24 to 48 hours, the end results, you get it.
Okay.
And it's super sophisticatedly automated,
Yeah.
and all those niche technologies came into that particular space.
Mm-hmm.
So this is great.
Mm.
This is something is done.
Mm.
Now, how will I analyze that GBs and TBs of data
Mm.
which has been generated? So
Yes.
that's always been a problem in a
Yes.
scientific world.
Mm-hmm.
How this AI and the software or the bioinformatics component comes and helps
Mhm.
us is crunching those big data
Yeah.
and getting a biological ration to it.
Mm-hmm.
So this potentially gives you a clinical report with clinical actionable insights.
Mm-hmm.
So phenomenal progress, phenomenal transformation. That's where in our industry, this is one of example, but it be it in drug discovery, cancer research, or even different modes of clinical diagnostics.
Mm-hmm.
It's phenomenal that these tools and technologies have come in and changed the game altogether.
Yeah. So it's more about efficiency and, again, like you said, focusing on the end result, and so that the researchers or diagnosticians, they're focused on the interpretation of the research rather than spending more time on the back end work of it.
Absolutely,
Yeah.
absolutely. So there are tools, after sequencing, there are tools, informatic softwares and platforms that can really do your primary, secondary, and tertiary analysis and give you a clinical report.
Mm-hmm.
If that's not the case, then if you're really doing it in a manual mode, you need 10 to 15 bioinformaticians experts, not like a basic level, but experts to come in and then do all your
those
variations, curations and analysis.
Mm-hmm.
So that is the change that
Mm-hmm.
what we are seeing, and that is helping all these complicated technologies to be introduced on a day-to-day basis.
Day-to-day basis.
Genomics into clinical practice is a game now.
Yes.
Right? It's just like your routine hematology and biochemistry analysis. Now, okay, you can get your DNA sequenced and all clinical insights could be understood. Phenomenal.
Yeah, absolutely. So with that in mind, what would be a conclusory statement or message that you would want to give the researchers or the diagnosticians, the people in the industry, the thick and thins of it? What would be the message that you would give them?
Message with my humble experience in science in the space is that we always should be curious, um, adoptive, and never say no to new innovations. The niche technologies, and always, it's nice to be exploratory. At the same time, COVID taught us how agile you should be and how quick you should be in terms of taking a decision, then moving on to a different scale. So, I mean, that's the aspect, essence that every scientific person should have. People like us, being facilitators, the entrepreneurs, the technopreneurs, you call it, had to be curious, had to be innovative, and then be ready for the change in a positive way. They call it disruption in a positive way. Yeah.
Absolutely.
So that's the exactly the point. And that will really create an impact in transforming the healthcare outcomes and the whole research and diagnostic outcomes altogether.
Truly well put. It's a game change. Disruption or change is the only constant that we should be expecting.
Absolutely.
Amazing. It's as usual a very wonderful, and I can't believe that you actually managed to make it crisp and concise.
You said 10 minutes. So what should I do? I can talk for 10 days.
Oh my, no. We could call you in for another one. Sure. So yes, thank you so much, Nirmal, for coming in and making the space and more informative. And we look forward to having you in more sessions and more conversations with more interesting people.
Absolutely. Thank you so much. And it's been a pleasure talking to you.
Absolutely. So this is Biotech Talk powered by Leader Life Sciences. Malavika Kanara signing off.